Temporary therapeutic measures before the surgical closure includes Whitehead's varnish pack. The pack is used over a socket and secured with suture. Whitehead's varnish composition is benzoin, storax, balsam of tolu, iodoform, solvent ether. Or a denture plate can be used. Denture plate is indicated when surgical repair of fistula is to be deferred. It provides barrier to prevent entry of food particles into the maxillary antrum. The management. Before closure of the orodental fistula, it is imperative to eliminate any acute or chronic infection within the sinus. This may require frequent irrigation of fistula and sinus combined with the use of antibiotics and nasal decongestants. The management of orodental fistula by flaps. In buccal flaps, we use Rahman's flap and Moxey's flap. In palatal's flap, Ashley's pedicle flap, palatal rotational advancement flap, and pedicle island flap. Regional flaps can be tongue flap, buccal fat, or cheek. Distance, we can use temporal muscle fascia for the distant flap in closure of orodental fistula. The bone grafts are also used. Alloplastic materials such as elastic titanium obturators can be used. The Rahman's buccal flap. In case of Rahman's buccal flap, it is a broad-based flap, and rather than the periosteal scoring, liberal undermining is done to advance the flap, which results into the obliteration of the buccal vestibular depth. This periosteum is incised, and then the defect is closed. This is trapezoidal sliding flap, that is Moxey's flap. It is also described as buccal sliding trapezoidal for closure of alveolar fistulas. The change in the vestibular sulcus is negligible by shifting the flap one tooth distally. The main disadvantage of this flap being that it necessitates greater amount of dento-gingival detachment in order to facilitate the shift. The distal shifting of the flap covers the orodental fistula, but it leaves the gap or defect medially on the buccal vestibule. As the raw area lies on the healthy bone, it heals uneventfully by granulation and subsequent epithelialization. The next is palatal island flap, which was given by Brosh in 1950. In this palatal island flap, it is used for closure of orodental defect, and it can be used in closure of larger fistula. It's a one-stage local procedure that provides a flap with an excellent bulk, a good blood supply, and mobility. Necrosis of the palatal bone of the donor side is not a problem with this procedure, as there is ample blood supply from the nasal mucosa. This procedure is suitable for the closure of posterior fistulas because it's pedicled on the greater palatine vessels. Its application is limited in closure of anterior defect only. Next is palatal rotational flap. This technique, in contrast, provides adequate mobility and tissue bulk to the flap. It requires the mobilization of large amount of palatal tissues. The flap often kinks following the rotation of the flap and cause venous congestions. Now, CALDWELL-LUC operation. It was given by George Cadwell in 1893 to gain entry into the maxillary sinus. The indications for CALDWELL-LUC operation is: first is removal of tooth root from the sinus, removal of any cyst, tumor or polyp, management of active bleeding from nose, removal of impacted canine or third molar, zygomaticomaxillary fracture during the floor of orbit. The procedure is: first, a semilunar incision is made in buccal vestibule from canine fossa to the second molar region. A full thickness mucoperiosteal flap is elevated using periosteal elevator till infraorbital region. An opening or window is created in anterior wall of sinus with help of chisel or dental drills. Opening is enlarged using Ronger forceps to permit proper inspection into the maxillary sinus. The pus is sucked away from the sinus and thorough irrigation should be done using saline water and betadine. Removal of tooth or tooth root is done. The thickened infected lining of the sinus is elevated using Howard's periosteal elevator and is removed. If profuse bleeding is there, then pack in the sinus with ribbon gauze soaked in adrenaline for 2 to 3 minutes. Antral cavity is again cleaned and packed with iodoform pack and suturing is done. Watertight suturing is done in case of CALDWELL-LUC operation. Antibiotics, analgesics and anti-inflammatory are given for 5 days. Pack is removed on 5th day. Benzoin inhalation should be given for 3 days followed by nasal drops. Patient should be instructed not to blow nose and have soft diet and avoid vigorous gargling. This is the diagram showing CALDWELL-LUC operation. It's showing the site of opening, which is above the premolars and molars. Intranasal antrostomy. It is performed to facilitate the drainage at the conclusion of an operation performed. It is used to close an oroantral fistula or to remove a tooth or a root from sinus. The drawbacks of intranasal antrostomy: it is controversial surgical procedure for the following reasons. It cannot drain the sinus satisfactorily, as the point created for drainage is not at the point of dependent drainage, due to the fact that antral floor is about 1.5 mm below the nasal floor. It also interferes with ciliary pathways, thus impedes normal physiological drainage of sinus. Thank you so much for your valuable time.